Are you treating the pelvic bones in your practice? In this episode, I'm going to share with you the importance of not only looking for the open birthing pattern in the pelvic bones, but what you could be assessing and treating in all of your patients. So join me for this episode as we dive into the pelvic bones beyond the open birthing pattern. But before we do that, I just want to let you know that the cohort for the Holistic Treatment of the Pregnant Body course is open for registration today, and it will be starting on the 21st. So you have one more week to join us. The first call will be on July 21st, and that's the start of the next cohort. So if you're interested in learning more about these pelvic bones, please make sure you check that out.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
So I would like to share with you a couple of case studies that I've been having over the last couple of weeks and months, and how I've been using the techniques that I teach in the Holistic Treatment of the Postpartum Body course beyond working with the open birthing pattern. Okay, so the pelvic bones are just so critical for the work that we do in the pelvic space, especially intravaginal work. And we need them nice and healthy and happy. And I know that if you've taken my holistic treatment of the postpartum body course, you have all the skills to do what I'm going to be talking about today in these case studies. And I just hope that this episode will expand your horizons on how to incorporate this work with all your clients. And you may already be doing this, so great if you are. And if you're not, then let's start thinking about how we can incorporate this with all of our clients, really. So I had a male come to see me, and I don't see a lot of men in my practice. He happened to be the husband of another client of mine, and he's been dealing with pelvic pain for, I don't know if it was 6 or 9 months. It might have been 9 months. This pain started after he was on the toilet having a bowel movement, and it never went away. So, shooting pains in the pelvic floor, pelvis. Just he tried everything in the 9 months, and he said he was pretty desperate. The pain had really gotten intense, and he was thinking that, this was going to be his life for the rest of his life. And he got very depressed, and I believe he was really depressed, and he had gotten somewhat better, but not great. Using some of mindfulness and breathing techniques, and he was looking at the mind-body connection and doing all the work and seeing everybody that he could. He's actually an acupuncturist himself. So he's trying to dry needle, he's seeing other practitioners, and his wife finally asked me if I would be willing to work with a man. And I finally relented and said yes. And he came in and explained everything that was going on. And I said, well, has anybody addressed your sphincter muscle? And he's like, no. And I said, okay, well, let's take a look. And so for me, you guys, you have to understand that I don't do intravaginal work on men. So I, apologized to him, and I said, you're going to have to bear with me here, but I can, externally, I was palpating and feeling all the tension in the sphincter muscle and the IRF, the ischiorectal fossa. And, I was addressing that, also addressing the sacrum. So my first go-to every time, you guys, on every single person, I slide my hand in when someone's in supine. I slide my hand underneath the sacrum and just feel how the sacrum lands in my hand. And I have to say, I think his tailbone was a little hard and the sacrum was a little hard. So I helped just offering compression to soften that. And then I went internally and worked with his sphincter muscle, which had a ton of knots in it. And so I treated that like I teach that in the holistic treatment of the postpartum body course. It's part of the protocol that I teach. And so I released the anal sphincter muscle, and then I went in and I released the IRF and the ischiorectal fossa, for those of you that are not familiar with the IRF. And that's between the ischial tuberosity and the sphincter muscle, the tissue all around there. It should give and push up in the inside easily on both sides. So you're comparing one side to the other. They should both be even. If it's not, then I encourage that tissue to move up towards the head, is the direction that we're mobilizing those tissues. And I have to say, he was about 80% better after that one session, just doing that work. And I have to say, this is kind of funny because, again, I don't treat men, but I was like, oh my gosh, your pubic bone is like right there. I'm used to having the vaginal opening, between the anus and the pubic bone, but I was shocked at how, the anatomy. It took me a little bit. And in fact, I tried doing it in prone. I tried it in side lying, and I'm like, do you mind if we just go supine? Because that's the orientation that I'm so used to. And that's when I was really able to like figure things out. Now I think I could do it a little bit better, but he was my test subject for this and he did not mind, let me tell you that. So he comes back for his second session and 80% better. Still, he said if he gets a flare up, it calms down so much easier. And yeah, he's just thrilled, beyond thrilled at the results. So then for whatever reason, I get him in side lying because I think one of his ischiums was really hard. And so I was kind of like feeling around and I got him in side lying with that hard ischium up on top. And as I was pressing on the ischium, my hand, again, I talked about in another podcast, I talked about my hand and how it lit up. The the rami bone was super, super hard on him on that side. And I didn't appreciate that the first session. And in this side lying position, I was pushing the ischium medially, and I could just feel that hardness of the rami bone that was super, super hard in my hand and had decreased mobility. And so I worked on that and helped it to soften using the techniques I teach in the postpartum body course. And I was just like, have you fallen? Did you fall on your buttocks at any point? And he's like, I don't know, maybe as a kid, I don't know. And I'm like, I can almost sense that this is from a fall or an impact into your body. And my sense is what I shared with him is that I think at some point in your life, you fell down, you hit your ischium and this rami bone, and it got hardened. So an osseous lesion in that bone. And then when you went to have a bowel movement, however many years later, that tissue couldn't give like it's supposed to on both sides and expand for the bowel movement. And that's what created the pain. And so we got 80% of the pain when we addressed just the structures. But when I released the rami bone and I also again did internal work with him and checked out his sphincter muscle, the pelvic floor muscles, and there really wasn't as much to do because I had cleared a lot of that up the first time I saw him. And he is doing great. He is incredibly grateful. And I just reached out to him and say, hey, do you mind if I share your story on my podcast? And he's like, absolutely, please do. Because he's like, there aren't that many people out there who can help us, Lynn. And so I just wanted to share that case study because we should be addressing the bones or at least assessing the bones in all of our pelvic pain patients. We should be assessing it in anybody with back pain, pelvic pain. Um, I had another client that I just saw today who is in her 70s and has had back pain and problems since the birth of her first 36 years ago. And when I went to assess her, her sacrum was so hard and the tailbone was so hard in my palm And as I tuned into it, so it was definitely stuck in extend or flexion. So the S3, 4, and 5 did not spring up towards the ceiling as well as 1 and 2, although her lumbar spine was really, really straight. So it had lost its lumbar curve, and the sacrum was not, the sacrum didn't want to move at all. It was just hard. And so I got it out of, helped get a little bit more extension into the sacrum. But else I noticed is that her PSISs were super wide, and she was a very petite person. And like I have large hands, and her PSISs I could almost barely reach and compress them together. And so I was like, I think she has a posterior sacrum because her PSISs would not mobilize medially. And so I got her in prone and put the towel rolls underneath her ASISs to help allow the sacrum to drop anteriorly. And then I was just medially mobilizing the PSISs. And then when she turned back over, it was like they were definitely more narrow and there was definitely more mobility in there. But then as I put my hand underneath her sacrum, I was just really drawn into the tailbone and how much it just wanted to compress up into her spine. So to me, it felt like there was a fall, there was a compression of that tailbone. And she told me, she's like, yeah, when I was younger, my brother pulled a chair out from under me when I went to go sit down. I landed right on my tailbone. And so there was also, not only the birthing stuff, but that previous fall. And so I invite you, if you're, working with our clients, we need to keep in mind the potential falls that may have occurred in the body, whether they remember it or not, the tissues do. So please keep looking for that and feel into it. When I just gently, with the tailbone in the palm of my hand, I tune into it, and my fingers are on the sacrum, and I'm just tuning into that tissue. And if I feel like there's this upward pull in those tissues, that to me is that compressive force from a fall. And she was also complaining of headaches. So I went to her cranium, and as I was tuning into her occiput, it was definitely pulling down. The dural tube was pulling down towards her sacrum. And so I helped to release that so that there was more space between the head and the sacrum. And she's such a beautiful lady. She really understands energy and everything's connected. And she just like had this sense in her body. And so it was really fun to work with her. And she was sore after she got up, and I'm planning on seeing her a few more times and seeing what we can do. She doesn't live in this area, so she's in town visiting a family member. But I just want you all to keep in mind the importance of feeling into the bones and looking for that hardness anywhere in that pelvic ring, and how much that hardness can impact the pelvic floor muscles, the adductors, the hip rotators, all of that. We need to be aware and be palpating and looking for the tensions, what's creating the tension there. And for my male pelvic pain patient with pelvic pain, um, it was so a critical piece of his recovery was helping that bone to feel better, so then the pelvic floor muscles could relax and then function better. So keep that in mind. And that side lying, for him, they were just so prominent when he had that on, and when he was in his side lying position, assessing that rami bone. So please, guys, look for that. Look for and be assessing the pelvic bones, and look for compressions from falls in the bone. It'll be hard, won't spring as much, and there's sometimes an energy of compression up towards the head that you can tune into and feel the energy pulling up as you tune into the tissues. So um, I like to follow that and offer more compression into the tissues, and then you wait and it releases and then it comes back down. Okay, so I've given you lots of gold here in this podcast. Hopefully you can translate it into your sessions with your clients. And please, for those of you that have taken the holistic treatment of the postpartum body course, please start looking at your other clients, not just looking at the techniques from the open birthing pattern. That's one aspect of this work, but these mobilizations and palpating the pelvis can really be brought to any person that you are working with, especially if you're sensing it, if you're looking for, you're going to find those hardness of that bone if they've had falls in their past and their histories. So please start looking for it, okay? And for those of you that have not taken the holistic treatment of the postpartum body course, please check out the website and join us for the live cohort. I would love to meet you on that. We do a welcome call on July 21st, 6 p.m. Mountain Daylight Time. And if you join the cohort, it's taking the online course, but with support. 3-4 live calls with me, and you get weekly emails spurring you through the course. And you're part of a group cohort, so you have access to our group chat, so you can ask questions in there and get support from me there and on the live calls. And we just really want you to get through the material and get this material in your hands. So I'm excited to see the group of practitioners that are planning on joining us for that cohort. This will be our second cohort. So thanks everybody for listening in. We will see you all in the next episode. And here is to smoother births, faster recoveries, and mobile, happy pelvises. Take care, everybody. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.